A large portion of Saskatchewan's population growth is due to immigration of new Canadians. However, immigrant mothers in our province are at a high risk to discontinue breastfeeding if they lack access to adequate supports. It's the focus of a research project taking place at the University of Regina. And to tell us more about it, we're joined now by Dr. Shela Hirani, an associate professor in the Faculty of Nursing. Thanks for your time today.
My pleasure.
What made you want to delve into this research?
I myself am an immigrant mother, and being in Saskatchewan, and I would say being in Canada, I've seen many other immigrant mothers who were new to Canada. They were from the diverse countries and then with the diverse cultural background. And many of them were facing the challenges with regard to the supports available from the healthcare professionals and from other people in their social network in regard to their breastfeeding practices. And to be very honest with you, that many times mothers do consider breastfeeding as a very private matter. And there are not many resources available, especially in Saskatchewan. We do not have many hospitals with the baby-friendly initiatives. And that actually jeopardize many much services offered to the immigrant mothers specifically in regard to how much accessible they are, how much affordable they are, or specifically how much culturally and gender sensitive they are. So especially if the young children are accompanied with the mothers and there is a breastfeeding discontinuation, that's a time period when they are at a very high risk. So my project basically tries to identify that what are some of the facilitators and the barriers that are actually not letting the mothers to sustain their breastfeeding practices. And the key idea is basically to identify the gaps in the offered services and what could be offered to those mothers. So in this research study, we also aim to identify the recommendations from the mothers and have their voice heard by others, especially the healthcare professionals, by the stakeholders and policymakers, so that we can offer better support systems for those mothers.
Have you made any preliminary findings so far with this study?
This is just I would say the study itself is a qualitative critical ethnographic study and itself is a preliminary research. Unfortunately, we don't have many research available in this area. And specifically, we do have few studies on the immigrant mothers, but none of them or very few of them actually are focusing on the breastfeeding practices of the immigrant mothers. So I would say that this is one of its kind, especially in Saskatchewan, where we are looking forward to have more baby-friendly initiatives in the hospital settings.
And with my last minute there, you kind of touched upon it. This study will be utilized by the Baby-Friendly Initiative. So maybe just tell me a little bit more about that before we run out of time here.
So basically, Baby-Friendly Initiative makes sure that mothers are being provided all the supports for promoting, protecting, and supporting their breastfeeding practices, and especially the time when the child is born, they're being offered all the related assistance, the help, the guidance in a very context-appropriate way. So that's what the focus of the baby-friendly hospital is. And then in all circumstances, what mothers can do once they discharge from the hospital, go to their home, and then what are the community-based supports that they can always approach and then access them to be able to sustain their breastfeeding practices. So Baby-Friendly Initiative actually gives a kind of a protection to the mother and baby. In different circumstances, they would be able to avail the different level of supports in the diverse care settings, especially the healthcare settings.
Sounds like a really important study and one that hasn't been really looked into yet here in our province. So all the best with your research. Again, that's Dr. Shela Hirani, an associate professor in the Faculty of Nursing at the U of R. Thanks again for your time today.
My pleasure.